Hello, my name is Anthony Artino from the Uniformed Services University of the Health Sciences in Bethesda, Maryland. I'm one of the deputy editors for JGME, and this month I'll be interviewing Dr. Stephen Weissbart. Dr. Weissbart is currently completing a female pelvic medicine and reconstructive surgery fellowship in the Department of OBGYN at the University of Pennsylvania in Philadelphia. Dr. Weissbart is the lead author of an original research article in the current issue of JGME entitled Relationship Between the Number of Residency Applications and the Yearly Match Rate. Time to start thinking about an application limit? As many of you know, there has been an increase in the number of applications submitted for the National Residency Matching Program. And with this increase in applications has come several associated negative effects, including added costs for medical student applicants, added time and effort for program directors, and an overall congestion in the application review process, which may result in a failure to select the best applicants. To address this problem, Dr. Weissbart and his colleagues explored whether or not additional applications are associated with benefits to match participants in the form of improved match rates. So, Dr. Weissbart, what made you and your colleagues want to study this topic?
Good morning. So together with my former program director, Dr. Jeffrey Stock, we were interested in studying the match because it really represents such a unique aspect of medical education and training. And from speaking to applicants as well as program directors and looking at match data, we learned that there's been a real surge in the number of applications that medical students are submitting for residency positions. And we wanted to investigate whether there was any benefit to match participants when such large volumes of applications are being submitted, as we believe they may be contributing to matching inefficiency.
Okay, great. So how did you and your colleagues go about investigating this problem?
Well, we used online data from ERIS and the NRMP to study the relationship between the mean number of applications submitted by an applicant in a given year and the corresponding match rate that year. Our hypothesis was that there would be no relationship between the number of applications submitted in aggregate and the match rate for that year.
Outstanding. Ultimately, what did you and your colleagues find?
Well, what we found was that there was no statistically significant relationship between the mean number of applications submitted by an applicant in a given year and the match rate that year. This would bring about the idea that the match could perhaps do without such a large volume of applications.
Okay. So with this finding in mind, what would you say are the implications of your work for program directors or more broadly for the National Residency Matching Program?
Well, the implication of our findings would be that in the future, the match may want to consider further investigation and eventually implementing a reasonably set application limit. A reasonably set application limit would help program directors as well as medical students. For program directors, it would help clarify for them which applicants were truly interested in their program, as opposed to which applicants were applying just for the sake of sending out another application. It would also afford them more time to review those applications of medical students who actually were really interested in their program. Most importantly, it would help medical students as well. A reasonably set application limit may help medical students get interviews at the programs that they really want to go to and are truly interested in. It would also provide them with a cost savings. And as we know, medical students are already in significant debt for medical school and their undergraduate studies.
Interesting. So it sounds like you're tentatively ready to recommend an application limit. But what research do you think would need to be done for you to more definitively recommend an application limit for the match?
Well, before we could definitively recommend an application limit to the match, we would need to study the relationship between the volume of applications that medical students are submitting and where on medical students' rank lists the students are matching to. It's possible that when additional applications are being submitted, that medical students are matching to higher positions on their rank lists. We don't think that that would really be the case, although it is possible, and therefore we want to study this before we can more definitively recommend an application limit.
Okay. Thanks, Dr. Weissbart, for taking the time to speak with me today about your study. I look forward to seeing more innovative research from you and your collaborators in the near future.
Well, thank you again for allowing me to explain our research, and we look forward to investigating match-related research again in the future.